Protect your DNA. BioPQQ can promote formation of new mitochondria. Infowarsstore.com.
Welcome back to the Infowars Nightly News. I'm your host, Rob Dew. Thanks to Leanne McAdoo for doing the news portion of the show. Yesterday, I put out a video called 3 Easy Ways to Avoid Obamacare. And what I was specifically talking about were the fees associated with Obamacare, because I don't think any of us are going to be able to avoid Obamacare entirely. This is going to turn into a giant monstrosity that's going to drive up healthcare costs, get rid of doctors, lower your options, and make you pay more out of pocket. And that's going to affect everybody downstream from that. But what I was specifically referring to were these health share ministries that cropped up in the 90s to basically help people pay for their medical expenses collectively as a group instead of relying on a giant insurance company. We are now joined by the Communications Director of LibertyHealthShare.org, Matthew Bellis. Matthew, how are you doing today?
I'm doing great, Drew. How are you?
I'm doing fine. Now, let's get into Obamacare. People were, when this was being written, it was done in secrecy. It was voted on in weird ways. Nobody ever saw what was going to be voted on. It's thousands of pages in length when it, healthcare shouldn't be that complicated. And now we're finding out that, the costs are going up. There's no more private doctors are going down. Rural hospitals are closing. What have you seen with Obamacare? What's really, what's gotten under your skin about this new program?
Well, we exist primarily for people who of religious faith and ethical beliefs to break free and be an alternative to health insurance. And so when the Affordable Care Act came around, we said we've got to provide this known alternative for people. And so I wouldn't say it's exactly what's gotten under our skin, but more or less that we feel that we need to present a different stance and an alternative to people who want to do their health care in a different way.
Okay. And insurance in general, I've had not a condition, but an accident back in 2012. I tore my left ACL, having tore my right 20 years previously.
Okay.
And I could never reach the deductible. And that's a big thing that people don't see that. It's like the hidden cost of health insurance. You don't realize, well, in addition to paying your premiums every month, you have to reach a certain level, $5,000, maybe even $10,000, before the insurance company even decides to kick in any money. And, that's something different about Liberty Share. Talk a little bit about that and how your what you guys don't really call a deductible, but how you do it a little differently than what most insurance companies offer.
Sure. Well, I want to make sure we understand clearly that we aren't an insurance company, and we're glad to be, and I'm sure you're aware of that.
Right.
And so the kind of terminology that we use is not the terminology that insurance companies use, but people who are a part of Liberty Health Share kind of go through some of the same processes, but there are pretty distinct differences. With people who come through our membership and our program, whenever they go to the doctor, they have their first set amount that we say that they're responsible for. It is $500 for an individual, $1,000 for a couple, $1,500 for a family, and from that point on, all of the dollar amounts that are a part of any type of medical bill are then shared amongst the community. So this is person-to-person medical cost sharing. It is individuals reaching out and giving another individual who is in need a monthly share amount.
Right, which is different than, insurance companies. You're paying your money each month to a giant corporation who then doles it out. They hold on to it. They create a giant bureaucracy or red tape to try, in my opinion, not to pay you. They try to get out of that because they're a for-profit company. And the way you guys are set up is individuals are sending money directly to people, and that's how you get around it, calling it insurance. Is that correct?
Well, there's a couple of things that we don't do that insurance companies do. Insurance companies, they spread out the risk, they transfer risk, and they promise to pay. And we don't do those things. One of those things, we don't transfer risk. We're all considered self-pay patients who are working together and helping one another pay off each other's medical bills. And that also means that we are all responsible for our own medical care. But we are voluntarily coming together and saying, you're a fellow man in need, and we want to be of help and of service to you. So the monthly amount that I would normally give to somebody, I'm going to give to you. And we do that stuff all in the back office, and we line people up with the shares and the needs. But we have found that people are able to take care of their medical bills, successfully take care of their medical bills, when it's done on a voluntary basis like that. What the executive director of our company likes to say that what a contract giveth, a contract can taketh away. And there's a whole industry of lawyers out there whose whole goal in life is to help get the insurance companies to pay. And we don't have that. We have individuals, person to person, helping each other with their medical expenses when they come up.
Yeah, and that, you know, we've had these videos of Gruber coming up saying we got to figure out how we can hide this and not call it a tax so people will approve it. And people are being sold something that really, you know, in the long run isn't going to help them. We've seen, you know, the healthcare going down in this country. But one thing I like about Liberty HealthShare and the other healthshare ministries that are out there, they always have an accountability section. It's not, hey, I'm going to take care of you. It's you take care of yourself first. We're there to help you, but and to share in the responsibility of the high cost of healthcare is what it's turned into. But you guys aren't you know, forcing anyone on this. You're not forcing anyone to play by a certain set of rules. You're like, here's our game field. If you want to come on it, you're welcome to, but it's all voluntary. There's nobody forcing you to get into this with a gun, which at Obamacare, they're starting to get that way. It's everybody's got to have it. But talk about the accountability aspect of it.
In what regard? The accountability of our members to members, or our members to the community? How is that?
Well, just in essence, the whole, you know, how we are accountable for our health, but by us all being accountable also to each other and helping each other out, it kind of just, it makes a giant, you know, boat, arc, whatever you want to call it, where everything's being taken care of and it's done efficiently.
Yeah. Again, we were all self-pay patients, and we're all individuals, and we, like I said before, voluntarily work with one another, and we found that's the best way to get the best results. We're all free people, and we should be able to live out those freedoms and help each other whenever there's need. We are a group of people that say we're not necessarily for the healthy people, but we're here for the health-conscious people, the people who aren't going to put off taking care of their bodies, you know, next year or next week until they get sick. You know, we're going to take measures right now to take care of our bodies. So we eat the right foods, we exercise, we do the things so that we don't get sick. And that is part of the reason why we don't have the exorbitant costs that you find in other healthcare programs. So we're accountable to each other in the regard that we want to take care of ourselves on the front end, but also we're accountable to each other on the back end. We're saying, you know, just like a Marine says, we're not going to leave a buddy behind lines. We're not going to leave our members out to dry whenever they come up with medical bills. We're going to help them pay those things off, and we have a track record of doing so rather successfully.
Yeah, you guys have been in operation since the 90s. Talk a little bit about the history of Liberty HealthShare, how it kind of reformed a few years ago, and then how you got into this, and you know, what attracted you to this business model.
Sure. Liberty HealthShare is a reformulation of a previous medical cost-sharing group called Christian Financial Death Assistance. They were a group of individuals who helped pay off end-of-life expenses when it came to hospice care, final surgeries that might be needed, things like that. And whenever the Affordable Care Act was upheld by the Supreme Court, we felt that it was time to reformulate that whole group, make it to a broader sense of health care, offer it to people who are like mind and like faith and like ethics, who want to take care of each other, and bring that to America at large and say this is a viable, available option that you can take hold of right now. We kind of say that we're not for everybody. Not everybody is going to grab on to the ideas and the prospects of being in a medical cost sharing group, but we're here for those who want to go down that path, who want to know exactly who they're giving their money to, who want to take control of their health care, who want to minimize costs, and want to be a part of that community. So that's how we kind of got started, where we came from. Myself personally, I was a member of Liberty HealthShare before I was the communications director. My wife, in September of last year, got a letter from her insurance company. We had just had our first child, David, and her insurance premiums were going to go up pretty substantially. Just for her and our son, we found out that premiums were going to go up to around $830, and that was not taking care of me. And I said, you know what, we got to look into Liberty HealthShare.
And that's per month too, right? That's per month. That's not on a yearly basis. That's coming out every month, $830. Yeah.
Right. That was the traditional insurance program.
For two people.
For two people. Yeah. For my wife and our son.
Right.
And we said, that's just not doable. We can't do that. And so we looked into Liberty HealthShare, and she was skeptical. And we are, I'm somebody who says, yeah, let's do it. Let's work it out, and we'll find out if it works or not later on. And she wants to make sure that all the ducks are in the row right away. Well, come actually earlier in 2014, in April, I got sick, actually. And it was a pretty substantial disease. It was called hilar sarcoidosis. I spent some time in the hospital, had some procedures done, and we found firsthand how the community comes together and successfully pays off medical bills. It was a great experience. We had never gone to the doctor before, but once we had Liberty HealthShare and we needed it, we found out the people were there. And it was a great personal story to say, wow, this really is something that works. And they said that they needed a communications director, and I was very much for Liberty HealthShare, and so I took on that position. So.
Well, and it does take a leap of faith to jump into a health sharing system, because you're not, it doesn't have, like, insurance has this giant, you know, kind of institutionalized feel to it, and people trust insurance, and they've been told and ingrained and brainwashed into thinking they have to have it, and they don't think of things differently. So it's definitely a different way of thinking outside the box. And, you know, we had the same system too. I'm with Samaritan Ministries, and my wife had an issue earlier this year. It cost us about, not that much, $650 after all the bills were paid. We sent in all the receipts. You know, the way you talk to the healthcare providers is you say, I don't have insurance, and you just pay with cash, and then you get reimbursed later. And we got almost, it was about $530, $40 back off of that 600 plus bill. So when you look at it, it was way better than a deal you could ever get with insurance. Insurance would never even come close to touching that. We would have just paid that $600 and had to lump it, in addition to paying the premiums each month.
Sure.
And those go to nameless, you know, bureaucrats and red tape artists and lawyers. It doesn't go to individual people. And I think that's a big, that's what makes me, you know, okay with sending the money in. I really feel good about, hey, I know exactly who I'm sending it to. I know what the problem was. And I'm helping out my fellow man. And one other thing, I did a video last night. It went up. It's got about 30,000 views now. And just talking about these alternatives to Obamacare, these health sharing ministries. The one I'm in, Samaritan, and I think MediShare, both have a minister requirement where they want a minister to look over your report, sign a yearly agreement. You guys don't actually have that same requirement. Talk about that and how that's a little different from the other programs that are out there.
Yeah, we believe that we're just trying to complement and round out the whole field of healthcare sharing ministries. We're not in direct competition with anybody. We just want to say, hey, we're another healthcare sharing ministry, and if you work with us or you want to work with another one, we're totally fine with that. We don't have a requirement where we're asking you to have a pastor or a minister or a rabbi or anybody sign off on a statement of faith or saying that you are attending church regularly. We're people that say, listen, as Christians, this is a Christian-based organization, but as Christians, we feel that it is very true of the Bible and what Jesus said, that we are to be salt and light and help to the world. not just the Christian community. And so we want to invite as many people as possible who want to be a part of our healthcare sharing ministry. We do have a set shared beliefs, and if you can agree with those, then we were meant for each other. We're happy to work with you. So where we have some differences, that's one of them. And so we're glad to be a part of the healthcare sharing movement. But we are folks that, from a Christian standpoint, say we want to be open to everybody.
Yeah, well, there was a few comments from, I guess, we do have a pretty big atheist crowd because we're a libertarian organization, very self-starter.
Okay.
And so they were getting on saying, you have to go to church to get your health care? That's ridiculous. Going, and they didn't take the time to watch the whole report, I guess. But,
Sure.
you guys were the last one that I mentioned, and you don't have that option. And I think that's great. I think each group should be able to set its own rules and say, these are the members we want to have in our group, and these are the members we don't want to have in our group.
Rob, you're right.
And I mean, that's part of freedom. People who don't want to believe in a certain way, if all the atheists want to get together and form their own health sharing group, they're more than welcome to. But unfortunately, they had to be in existence before December 31st, 1999 in order to get out of that Obamacare fee. And that's a big sticking point for a lot of people. Anything new coming along, which all these ideas are great, these other co-ops that I've seen out there, but you have to have been in existence, since 1999 in effect to get that waiver for the Obamacare fees. Is there anything else you want to add at the end of this? We've talked a lot about your company. You guys have three different share options available. And, maybe a parting shot at the health insurance industry in general. Like the reason it's not going to change until we start taking away its power, which is taking away its money, essentially.
Well, we essentially are a grassroots organization. We are, again, a group of people who, we're not asking for permission. We're not saying, can we share medical costs with each other? We're doing it. We're doing it because it's the right thing to do. Is it cheaper than other forms of insurance and healthcare? Sure, we're an alternative. But cheap healthcare is not the reason why we're here. It's good to be able to control your own healthcare decisions, but that's not why we're here. And we're not here specifically for medical cost sharing. That's not the be-all, end-all for us. For us, it is a matter of conscience to say, I am my own person, I am an individual, I have the right to direct my own health care, I have the right to pay for the things that I want to pay for, not be forced to pay for things I don't want to. We're going to direct our own health care free from the dictates of government, and we're going to do those things that are the right thing to do, that are directed by our conscience and our faith. And so that's why we exist. There are items that are good, and there are things that are good about medical cost sharing, but those good things support the real reason why we are here. There's a reason why we're called Liberty, and it's because we are individuals exercising our free right to maintain, control, and direct our own health care and be of help to those individuals who want to do the exact same thing. We're endowed by our Creator with certain inalienable rights, and we are claiming those rights, and we're sharing medical expenses based on those rights.
That is very well said. It sounds like you prepared that speech. That was very eloquent. And
it was off the top of my head.
Well, I tell you, it rings true. I mean, liberty is a foundational principle of this country. And people who want to join a giant bureaucracy or have socialism, move to France, move to Sweden, see how great it's going there, see how their economies are doing. And, get out of America and let us have our freedom. That's all I ask. And I totally agree with what you guys are doing. I'm really on board with this health sharing thing. I just found out about it. It was last October when we joined. And as soon as I heard about it, we were looking at about it for the whole family. It was going to be about $850 a month. And then we were going to have a $10,000 deductible on it for one of the health care plans we were looking at. And I just couldn't stomach that. I could not stomach sending over $8,000 a year to an organization that was then going to deny me health care, at least deny it in the way of reimbursements and paying it back and being able to use it in a timely manner and in the way that I wanted to use it. There were so many controls, and you guys are offering freedom. You're promoting it well, and I just see big things. You guys are having a massive growth right now. I would suspect. that correct?
So month over month, we're hitting some record numbers.
Yeah.
And we're pleased to be available for people, and we're happy to be an alternative to folks who want to break free from the systems.
There you go. Well, we appreciate what you're doing out there, Matthew Bellis with libertyhealthshare.org. You can find out all the information there at libertyhealthshare.org. And yeah, we'll probably have a check-in with you in a couple months or so, see how things are going. And I definitely send me an email in a few days. Let me know if you hit a bump from the Infowars audience, because people were definitely hungry from this information. And I think you're going to see a lot of growth, and you guys and the other healthcare ministries out there, because it is a positive program and it's something that we need to see more of in this country.
Well, Rob, thank you so much for helping us spread the word. We appreciate it. As a nonprofit, we don't have huge marketing budgets, so things like this definitely help get the word out.
Great. Well, you take care and have a good day.
Thank you, Rob. Have a good day.
So there are health sharing options for everyone out there. I encourage you to go back and check out the video, 3 Easy Ways to Avoid Obamacare. I list the links to the 3 health sharing ministries. You should check them out and see which one is going to fit best for your budget. And we appreciate them for being out there and offering alternatives to Obamacare. And that's it for our show tonight. I'm your host, Rob Dew. Thanks for joining us. If you're watching this on YouTube, please consider becoming a member of PrisonPlanet.tv. Right now, we're running our biggest special ever, $29.95 per year. Plus, you can share your username and password with up to 20 people. You can share it with more, but only 20 of you at a time can get on and sign in and watch everything live. Thank you for your support. Please consider becoming a member. And that's our show for tonight. Please join us tomorrow night, 7 p.m. Central.
I began to get into iodine a few years ago because it was helping me and my family so much get healthy and detoxify. I believe our research is conclusive. This is the best iodine out there. And I know this for a fact. Nobody else has got iodine based on these pure crystals, ladies and gentlemen.
For a limited time, experience the ancient power of Survival Shield X2. Take advantage of this unprecedented 30% off Super Detox Special at InfoWarsLife.com.
You are watching the Infowars Nightly News, which airs 7 p.m. Central at InfoWarsNews.com. Members can share their passcodes with up to 11 other people, and your support is helping us defend liberty worldwide.